What is informed consent? Is it that you need my permission before I have treatment?
Is it to make sure the doctors are covering their own backs in case something goes wrong?
It's signing your life away?
Is it about choosing the best treatment?
Is it to make sure I know what I'm letting myself in for now and in the future in case I decide to go ahead?
There are patients who think that informed consent is just about signing a form, but there's a lot more to it. It's actually an ongoing discussion which is a legal and ethical requirement. These sorts of discussions take time, and often there isn't as much time as we would like. It depends how urgent the treatment is. At the end of the day, it's our role to give patients enough information about their treatment options, including the risks, the benefits, and alternatives. And the role of the patient in this is as important as ours, because ultimately we are partners in managing their health. There are two ways you come in for coronary angioplasty. You'll either visit the cardiology clinic as an outpatient well in advance of your planned treatment, or you may have been admitted to hospital more urgently. Either way, a doctor will ask you about your health problem and recommend some treatment options. So, Mrs. Peters, these are the arteries that feed the heart muscle with blood, and you have a narrowing here.
Right.
Okay. Tell me, how are you getting on with the tablets?
Well, I've been on them a long time, but I'm still getting chest heaviness, and I don't want to carry on just as I am.
No.
My GP thought I should be referred to a cardiologist.
Sure, okay. Well, with the type of narrowing that you have, Mrs. Peters, I think that stents are probably the best option. But there is a choice. So here's an information leaflet for you to have a look through. We'll see you at the pre-admission clinic and take it from there.
Okay, thank you. The doctor told me I could have the stent, but there are other options. I could have my medication increased. To help me to make a decision, I was given lots of written information and good websites. This really helped me to understand what's involved in the different treatment options. It was great to be able to talk it through with my family and my GP. But in the end, I need to make the decision.
Before the patient goes ahead, we would have a detailed discussion about the goals for the treatment, including the risks, benefits, alternative treatment options, and what would happen if the patient decided to have no treatment. We would also talk about what future treatments might be required. This conversation would usually happen at the pre-op assessment or on the ward if the treatment was urgent. The patient might be asked to read and sign a consent form at this point. Any medical procedure carries some sort of risk, so it's important that you understand the one that's linked to coronary angioplasty. It's a treatment that's done under local anaesthetic, so you'll be awake. And what we do is we make a small cut in the groin or in the wrist and put in a plastic tube. We then do an X-ray to see where we're going, and then we feed the plastic tube up through to the blood vessels that supply the heart muscle with blood. We then squirt in some dye. If we see a narrowing, we will put a tiny balloon up into the blood vessel, inflate the balloon, which widens the blood vessel. We then use a stent, which is like a tiny metal scaffold, to hold the blood vessel open. You'll be given blood thinning medication to keep the blood flowing. The stent cannot move and ultimately will become part of the blood vessel wall once it's healed. You might get some bruising or swelling where the tube was inserted.
What happens if things don't go according to plan?
Okay, did you understand the written information we gave you?
I read a booklet, but I didn't understand it all. It said something about having a stroke and something about dying, which was a bit scary.
Okay, well, as I've said, any medical procedure carries some risk. You mentioned a stroke. Out of 1,000 people who have this treatment, it's estimated that one might have a stroke. 1 in 100 might have a heart attack, and fewer than 1 in 1,000 might not survive. So given your age and your health profile, the risks might be slightly higher for you. So I think it's important that we discuss alternative treatment options and what might happen if you decided to have no treatment.
If I have the treatment, will it stop me having a heart attack? Will it make me live longer?
No, because your treatment isn't urgent, because you're having a planned angioplasty, the treatment won't change those things. But the good news is that by leading a healthy lifestyle and taking your heart protective medication, you can reduce the chance of narrowing happening again. Ultimately, you can reduce the risk of future heart problems. Do you have any more questions?
No, I think you've answered pretty much everything. My doctor was really helpful in giving me the information about the risks linked to having the treatment. I was able to find out what the risk was to the average person on the street, but more importantly, I was able to find out what the risk was to me. These two are not always the same, as people may have other health complaints. I thought that angioplasty would fix my heart vessels, but it does not fix the condition. However, it does usually relieve the symptoms. I did not know that there might be alternative options, or that I would probably need to have repeat procedures in the future. It helped to know that I was an equal partner in making this decision about my health. It was really reassuring to know exactly what would happen on the day and who would be doing my operation. I didn't know how long my recovery would be, but I had plenty of opportunity to ask questions before I signed the consent form.
Immediately before the treatment, the doctor who is operating will confirm that the patient understands all the details about the procedure, including the risks and benefits. Good morning. Hello.
Oh, hi. Hello, Doctor.
I'm Dr. Stevenson. I'm going to be doing your angioplasty procedure today. Now, I'm sure everything's been explained to you and I have your consent form here, but I just wanted to double check that you're happy with everything. So, can you tell me about what you're expecting to happen today?
They're putting a kind of tube through my groin and up into my heart, and they're going to put a couple of stents into where the arteries have narrowed.
That's right, yes. And can you tell me, please, what you understand about the risks that are linked to this procedure?
Well, the doctor explained that there's a small chance of stroke. About 1 in 1,000 people like myself may have a stroke. There's also something about a heart attack.
Yeah, that's right. There's a risk that 1 in 100 might have a heart attack and less than 1 in 1,000 might not survive. Is that something that was explained to you?
Yeah, he did go through all that.
So I can tell that you're clear about the risks and benefits that are associated with this treatment. You have a choice as to whether or not you have this procedure, but as you know, it is a treatment that's usually successful in relieving symptoms. So do you have any other questions?
No, I'm as happy as I can be.
Okay, great. Let's get you down to the lab then.
Okay. Before you say yes, please make sure you understand what the treatment involves and whether there are alternative treatments. You also have the option to understand what would happen if you have no treatment. It always helps to have written information in advance.
Before you say yes, please make sure you've enough time to make a decision. If your treatment is urgent, there will be less time to do so.
Before you say yes, please make sure you have asked any questions you need answering about your treatment.
Before you say yes, please understand all the risks and benefits of the treatment you're going to have. Everybody is different, and some people need more details than others. But at the end of the day, the doctor is required to tell you all about the risks, the benefits, and about alternative treatments.
On the day of the treatment, the operating doctor will recap on everything with you to make sure you're happy to go ahead. You have the right to make decisions about your own treatment, and we are here to help.